Hi everyone, thank you so much for taking the time to attend this meeting. My name is Emma Ludwig and today I'm going to discuss with you patient flow and how to improve patient flow in order to have a more efficient and effective emergency room. But first, I want to paint a picture of an emergency room that you and I have probably already attended ourselves. So the scenario is you're cooking in your kitchen and you slip and cut your finger. You take care of it, but you realize that the cut is a lot deeper than you originally thought and that you're probably going to need some stitches. So you take yourself to the hospital. You drive there, you park, you walk into the emergency room, and you sign in all the while before sitting down. After a while, someone calls you up to the counter to get your driver's license and your insurance information before telling you to have a seat back down. Some more time passes. After sitting and bleeding in the emergency room, you're finally taken back to triage where they go over some medical information, get your health history, and go over why you're there and what happened. The nurse will then examine you and will probably only place gauze until the physician gets there. All of this, say 2 hours, you still have not seen the physician. Possibly another hour goes by when the physician walks in, discusses all the information that you've already given them, examines your finger, and will probably agree that you do need some stitches. He'll then ask the nurse to stitch you up. She'll do that, which took probably all of 5 minutes. You're then released with instructions on how to care for your stitches. A simple 5-minute procedure took hours because the hospital you went to does not have a good patient flow system in place. So what is patient flow? Patient flow can be described as how a patient moves within the confines of a hospital. The YouTube video, Lean in Healthcare, Teachable Moment, Improving Patient Flow in the Emergency Department, we hear from David Kish, the Executive Director, Emergency Services and Patient Logistics at St. Clair Hospital in Pittsburgh, Pennsylvania. Mr. Kish discusses the noticeable problems within their emergency department and how dissatisfied their patients were because of it. The examples Mr. Kish stated were as follows: long waiting times, patients leaving the emergency department before seeing a physician, as well as very frustrated staff. Before changes were made, it would take around 81 minutes for the patient to see the physician. After changes were made, data was collected and the following statistics were given. Patients' door-to-room time pre-change is 54 minutes, where post-change is 18 minutes. Patients' door-to-physician time pre-change is 81 minutes, whereas post-change was 40 minutes. And then the average of patients leaving before seeing a physician pre-change was 130 patients, whereas post-change was only 15 patients. Joanne Indo states in the article Improving Patient Flow, Enduring Issues, New Challenges, one of the best ways for patients to be involved in improving the flow is to simply ask the patient, have a discussion with them about their experience, what they liked and disliked, where they felt we needed to improve, or what we should continue doing. Another way to learn about patient flow within the hospital, Ms. Indo recommends, is to shadow the patient throughout their care while collecting data. With that data, a flow chart will be created stating the patient's visit. In doing this, the provider is able to understand the patient's viewpoint, which is hard to do with any other way. Mrs. Indo also gives recommendations on having a better frontline care for patient intake, meaning the initial intake of a patient when the patient first walks into the emergency room. Therefore, they're able to take patients back into rooms quickly and efficiently. Taking patients into a treatment room as soon as a room becomes available will cut down on the time the patient is in the waiting room, which also allows the patient to be taken care of much quicker. Patient flow is the most important factor in the emergency department, and when a good system is in place, the patients have a higher satisfaction rate and will most likely come back when they need the emergency room. Thank you so much for listening, and please feel free to ask if you have any questions.